Welcome to this is episode 1 of season 2 of 24/7 Health News, hosted by myself, Health Coach Shay. So these topics tend to be from my blog or some other topic that I think is important to health and fitness. So today it'll be a important topic. Because these topics are important to your health, I try to break them down and simplify so that you can apply them to your daily life. Again, I'm Health Coach Shay, and it sounds funny to say. I'm a master trainer, a holistic health coach, all certified. So let me give you a few disclaimers. My information is not meant to prescribe or be taken in lieu of a discussion with your doctor or healthcare professional. You should always speak to your healthcare professional before making nutrition or fitness changes. I'm a health coach and I'm making recommendations only in that capacity or through my lived experience. This blog is where science meets a little strategy. I believe in your DNA and my DNA and how it becomes important to our ongoing health and fitness. So let's get started with the topic for today. So I did I would say a prelude to my being absent for quite some time. And we're going to continue with that prelude today. I'm going to try to wrap it up. It might be a good long one. So today we're going to start with some stroke information. And this is an article from the website, Early Stroke Warnings in Women Over 40. So this is applicable to all women and men, but I decided to boil it down a little bit to women over 40 because strokes are quiet. And they don't say, hey, you got something going on. You might feel micro things happening to you, but you might not attribute them to a stroke. So after age 40, a lot of things shift with women, especially. You have hormonal changes. You have inflammation tends to increase. Blood pressure can subtly change or change a lot depending on what you're doing with your life. Insulin resistance becomes more common, and chronic stress compounds vascular strain. And all of this leads back to your vascular strain or vascular elasticity. Like I said before, these changes are not necessarily dramatic, but they create a cumulative risk. And so that's what kind of happened to me. It was a cumulative risk. I don't have a particular diagnosis, but I had about 3 or 4 of those things going on that made one very large stroke. Here are some warning signs that you should never be ignored, right? And if all of these happen, you should go to the doctor immediately or call an ambulance, depending on how severe. So sudden or unusual brain fog can definitely show you that something is going on. Women often dismiss these as stress or perimenopause. Sometimes it is, sometimes it isn't. Difficulty finding words, sudden confusion, or short-term memory disruption is one of the initial things you should take a look at when it's happening and how it's happening. Then unexplained headaches. So a sudden severe headache, especially if it feels different from your normal pattern. And what that means is, so say I'm a person who has sinus issues, and then I take on my usual stuff. Again, this is what happened to me, and the headache doesn't go away. I'm with it for 3 or 4 days, and it still doesn't seem to go away. And if the intensity changes or there are visual disturbances, blurry vision and things like that, you have a headache in your neck or your neck is stiff, that's a big thing. This is where we get into the stuff that really freaks me out. temporary numbness or tingling, particularly on one side of the body. Now, you know that to be, most people know that to be a regular stroke kind of thing. So if you have a combination and then you add this to it, you got to go to the doctor. You got to go fast. These can be transient ischemic attacks, often called mini strokes, TIAs. They are warning signs and they are not harmless events. So I had a full-on ischemic stroke. So I just want you to know that that's little small things are not harmless. Blurry vision also, vision changes. Blurry vision, double vision, sudden loss of peripheral sight. These are symptoms commonly dismissed as eye strain or aging. Start combining all of these things, and you need to go get a full workup, go get your blood done, go get all that done. Unusual, overwhelming fatigue that feels out of proportion may signal vascular distress. So I'm going to read this other line in a minute, but I never felt like I could not be tired. You know how you rest and you never feel rested? That is a problem. So any kind of unexplained dizziness or imbalance, again, the totality of things is what we're looking at. So one or two of these little things mean you should go to the doctor and get it checked out. But when you start getting past one or two or three, you should immediately go to the doctor and get these things checked out. So let's talk about some things that we ignore besides all that stuff I just mentioned. Elevated inflammation marker, insulin resistance, which means you might be carrying some weight around the belt, elevated blood pressure, chronic sleep disruption, unmanaged stress load, and stuff in your family history. You may feel fine while risk accumulates quietly. That is part of the problem. We may think, okay, I'm going to get to this workout and I'll be okay and I'll start to feel better. Nope. You need to get this stuff checked out. This is just early stroke signs. And generic advice isn't enough. So what I'm giving you basically is, kind of generic, because you have to look at it yourself and all the things that's happening with you. Do you eat healthy? Do you exercise? And do you manage your stress? That stuff is important. But that stuff is not precise enough. You need a risk assessment. You need to ask your doctor questions. You need a lab interpretation. You need to talk to your doctor about what kind of supplements you're taking. And you need a lifestyle strategy that matches. So I want you to seek this stuff out and try to figure out if these are some of your symptoms and have you been checked out lately. So you know what the regular, stroke things are, where you need to immediately seek medical attention. I'm just going to call them out just because I want you to keep them in mind. Facial drooping, arm weakness, slurred speech, sudden confusion, severe headache, and sudden vision loss. That's call the doctor or go to the emergency room immediately. Don't wait. Don't think it's going to clear. Don't do any of that. Go to the doctor. When you're over 40, you should be proactively considering reviewing your inflammation markers, monitoring your blood pressure, evaluating your metabolic health, and assessing what type of supplements you're having and the quality of those supplements, and identifying genetic predispositions. Genetic and predispositions. You should be looking at all those things. You should get a full workup if you're at a certain age for strokes. Strokes are on the rise as well. And that's one of the things that's really, really scary. It's on the rise because we have so much stress. Stress is the great sidebar that nobody covers. My doctors to be honest, absolutely refuse to blame it on that. Because if they do, then they know. Now that sets me up for, all kinds of things. So after I had a stroke, I stopped assuming that my labs are normal, because normal is this range that they think is okay. When borderline is in the normal range, and everything being on the border is not what you want. I stopped relying on just generalized advice and started learning what questions to ask. I'm a health coach, so I knew some, but I had to really do the research. Excuse me. I focused on being precise about evaluating my real risk. So that's one of the things that you should really keep in mind about it. Let's go a little further. So why do we think strokes are silent? Because all of those things I mentioned about the early stroke signs are gradual, right? When I talk about that normal range, if you gradually move up on that normal range, as long as you stay in it, your doctor's going to say you're in normal range and everything is okay. So you have to poke at it a little more, find someone who's going to sort of say, well, wait a minute, is this normal for you? Your memory lapses, that's definitely something you should check out through your family, the women in your family, specifically, and the men, see if you have those sorts of markers in your family. This is a hard one, mood or personality changes. Those to me are attributed to stress. If you're pissed off all the time, you're tired. If you're pissed off all the time, you haven't had enough sleep. If you're pissed off all the time, you have too much stress. You need to give it to someone else. I recently said it to someone like that, and they kind of looked at me funny. I was like, no, you need to give your stress to someone else. Just like you delegate at a job, you delegate in a home. You need to delegate some of that stress out to someone else. Let somebody else take care of stuff. So, like I said, the things I want to re-mention those risk factors. I want you to really drill down on these. Your chronic inflammation, your high blood pressure, your insulin resistance. Listen, smoking, and more smoking. And I'm talking about cigarettes. Sedentary lifestyle and sleep apnea. If you breathe with your mouth open, if you use one of those machines, those things are not good. And I hope you keep it clean, because I've heard terrible things about what people have done to themselves without cleaning them. So how do we reduce our silent stroke risk? You monitor your inflammation. You manage your blood pressure. You optimize your metabolic health. And you use targeted supplementation. And finally, and one of the most largest things, is you reduce that stress. You delegate. Remember that. You delegate. So let's take a look at a complete guide to trying to prevent a stroke. Again, we know why it's worse after 40, right? Your estrogen fluctuates, and that affects your vascular elasticity. Your chronic inflammation increases. Your blood pressure trends might shift behind the scenes. You definitely become more insulin resistant, and your stress accumulates, and that impacts your vascular tone. These changes don't have to be dramatic, but they compound over time. As I mentioned before, everything was on the border. So all of my stuff was still in the green, just on the border. So even mild Let's take high blood pressure, for instance. Even mildly elevated readings over time increase vascular change. I once thought to myself after I had my stroke that I have done things to my person, my system over the last how many ever years, right? How many ever years old you are, right? And so how long does it take for you to reverse that if you don't take a look at it soon or early, or if you haven't been paying attention to it for the longest? So the high blood pressure is definitely something we all tend to ignore. People do not like I'm losing that word. The things that happen when you take blood pressure medicine, the side effects, that's the word I'm looking for. My apologies. The side effects that sometimes happen from blood pressure medicine. So it's difficult to find something in most medications that don't have a side effect. But you definitely, if your blood pressure is too high, you definitely have to take a look at it. Also, the inflammation. That's not something that is talked about, I don't think, very often. But inflammation damages your blood vessels. And so it can be a quiet thing. It can be something that's not measured and we don't look at it. The only way that you will have that conversation is if you run a full blood panel with your doctors and they take a look at it and you ask that specific thing. Your chronic stress and your poor sleep. I think these are the two things that happen to women that they don't address very well. They know it's happening, but somehow they're not able to get it taken care of. The sleep especially. You got to get some rest. You got to get whatever 6 to 8 hours that you can, and it has to be good rest. That's one of the reasons why I actually measure mine, because you have to have some sort of decent rest where your body, and it doesn't necessarily shut down. I don't like it when people say that, but it goes into, like when, in the movies, people plug in those computers and they go into repair mode or it is rest mode, but it is something that allows your body, it's not doing everything else, so it can actually focus on repairing itself. So again, do not ignore these symptoms that are very subtle. Sudden confusion, numbness on one side, vision changes, and a severe unexplained headache and dizziness and imbalance. You have to pay attention to your body. You have to make sure that you're taking a look at these things, because if you don't, you never know what can happen. You never know how your body is going to react. These little silent symptoms like progressive brain fog, subtle memory decline, decreased processing speed, which is one that we don't really pay attention to. If it's taking some time for somebody to explain something to you and you need it over and over again, what's going on? And this last one, mood changes, is really something that we don't look at all because it's always blamed on menopause. Let's face it, a lot of these symptoms in women are definitely ignored because they're blamed on menopause. They're just blamed on menopause. Everything is blamed on menopause. I know you've been watching, Halle Berry champion all of this stuff. So some of the lab markers that you might want to take a look at: the inflammation, which is called HSCRP. When you get you have to fast and you get the blood test, your fasting insulin, where is that? Where's your A1C? Where's your lipid panels, which means where's your cholesterol? I never said this one right, homeocysteine. Where are these numbers? Where's your vitamin D? And where is your blood pressure trending? You have to take a look at all of these to make sure that these are normal ranges, but what are the changes for you? There's something on my health app that I didn't even pay attention to. They have they have charts. Like if you've had your blood pressure done over a certain amount of time, and they have a chart. You can click on the chart part where you don't look at the numbers, and you can look at the trend. And if you see a trend going up, it's worth having a conversation about. So there's some natural ways, and I'm always down with natural. But see, when I say natural, I mean personal, how you're doing things, right? I don't mean don't get your blood drawn, don't go get these things tested. I'm saying things like anti-inflammatory nutrition, taking targeted supplements, making sure that the supplements that you take are as natural as they can possibly be. Everything's manufactured, but as natural as they can possibly be, and that they're specific. Make sure you are monitoring your blood pressure. I monitor my blood pressure all the time. And then your stress regulation techniques. Do you take an hour a day for you? And I mean just for you. Not your lunchtime, not, oh, I'm driving home in the car and that's my peace time, because you're still doing something that's not less stress. Driving, depending on where you live, is a pain. Do you get some time, 15, 20, 30, 45 minutes, an hour preferably, to take control of your stress, regulate yourself, notch it down, meditate, punch a bag, whatever it is that you need to do to release your stress? Do you get it? And is it consistent? Do you have consistent movement? Are you getting some sort of physical exercise? In one of my podcasts, I think it was just the previous one, I was talking about when you go out and you park somewhere, park away from where you need to go so you can walk. That gets steps in. That's good for you. And are you optimizing your sleep? I really can't say enough about your sleep. Ideas about optimizing your sleep: drink tea. Take a hot shower before you go to bed. Sauna before you go to bed. Sauna, then shower before you go to bed. I would not ice bath before you go to bed, because that kind of wakes up your system. You want to notch it down. You want to warm it up and relax it. And you want to make sure that you're producing, which escapes me right now. I tell you, AS is kicking in after stroke. Melatonin. You want to make sure that your system is producing the melatonin. You've given it some room to do that. And remember that generic advice helps a little bit. You need to get specific about what your body is doing and ensure, and I'm going to do this seek emergency care immediately thing. I'm going to do that one more time before I get off of here and talk about a few other things. Facial drooping, arm weakness, slurred speech, sudden confusion, sudden vision loss, severe headache. That's an emergency. That's call the doctor. That's go to the emergency room. That's not just call the doctor. I'm sorry. Go to the emergency room. You should use a precision approach to stroke prevention. Ooh, I'm tongue-tied today. You should do a risk assessment. You should get your labs interpreted. You should evaluate what supplements you're taking. And you should do all that as quickly as you possibly can, especially if you're over 40. I would say that approaching 35 is when I would start really getting into this. I could go all the way back to 38 if I thought about it. Because the stress we give our body is long term. We think once we're out of whatever situation that's stressing us out, it goes away. I can tell you, it gives you some vascular damage if you do not recognize that was a heavy level of stress, and you don't fix it. You don't find a way to release the stress. So anyway, that has been my big push for stroke prevention, I should say. So I want you all to, listen to the various things and see what's happening with you and see if you have any of those markers and take a look and get proactive about your prevention. And because of that, I've been thinking about this little program that I wanted to put together that's designed to identify your risk factors, and they could be hiding. And it's a really good personalized roadmap to help you get to what's going on with you. It gives you a lot of information. So I have 3 articles about stroke spread out on my daily health news. Maybe not too spread out. There's a couple of them together, and I published one. And then you got the prelude to all this stroke talk in the first intro podcast for me coming back. I'm going to move on. I said on my last prelude, I was going to move on to GLP-1s, and I am. That's going to be in the next podcast. It's not going to be what I think it's going to be. I'm going to try to keep it to what they do, how they work, and how they help you lose weight. Because I don't think medications, well, some of them are inherently bad, but I think that you need to take all the help you can get, and you have to make an informed decision before you get ready to use something. That's what I think. I think that's probably the most important thought I could put out there. You have to make an informed decision, and you should do your pre-work beforehand. So again, I'm calling this a brain risk assessment, where we take a look at what's going on with you. And I've pulled together all of my sponsors to sort of help me with the various bits and pieces of this. So we can run a DNA health and fitness test. If you don't have a doctor, we can help you get your labs going. We can do all kinds of things to help you get to this brain risk assessment. Lab review, and then we can evaluate what supplements you're taking and help you and make some suggestions. That's one of my sponsors as well. We can help make some suggestions to you about your supplementation and what you need. And then I definitely want to offer that DNA health and wellness set. That gives you a wealth of information. It talks about if you're insulin resistant. It talks about what type of exercises and how they affect your body, how certain supplements affect your body. That's, to me, the key to a lot of this. So I want you to check it out. So again, check out my sponsors. My Healing 365 is our telehealth clinic. That's one of our sponsors. Sage Life Therapeutics, supplements and vitamins. They help you. As you know, this is 24/7 health news. Constant health news is posting to the website about various things, because look at what's going on in healthcare. We have to pay attention and ask the right questions, because when it's just in the normal range, they're not going to tell you anything different. So I wanted to tell you thank you for listening, and thanks to my sponsors. So my Healing 365 is one of my sponsors. Great telehealth community helping you without leaving your home. Again, Sage Life Therapeutics, my vitamins and supplement folks will help you out with all you need. And then we have the 24/7 Health News, where we combine all of our blog information. And a new one that just added on is called Dirt. It's a camping site. Well, you'll see this wonderful boondocking spot where you can do, if outdoors is your thing, you can do all this camping. And last but not least, I'm going to put the link that is related to all this, called the Brain Risk Assessment. And I want you to take a look at that and see if it's a fit for you. It includes all of the things that I have discussed that you may need to check up on, or at least a combination of these things so we can get you all looked at. So if you don't feel like your doctor is making the cut, or even if you do, we can help you sort of pull all this information together and take a look at it as a whole and see what your risks are and see what we can help you get straightened out. At the very least, we can definitely give you a roadmap to your body and what's normal for you. Because again, the doctors are talking about those dreaded normal ranges, which is what bit me in the butt. And as far as I'm concerned, caused the stroke because I was in normal ranges for everything and I don't smoke. So again, have a wonderful day. Take care of yourself.